On September 14, 2018, the Center for Disease Control released a new report estimating that 50 million Americans, or just over 20% of the adult population, are living with chronic pain, and about 20 million of them have pain severe enough that it frequently limits their normal life and work activities. Chronic pain has been linked to anxiety, depression, opioid addiction, restricted mobility, and reduced quality of life. It contributes to an estimated $560 billion a year in medical costs, lost productivity, and disability programs in the United States. There are many different treatment options for chronic pain. Some of the most common treatments recommended for chronic pain include oral medications, injections, and physical therapy. But pain medications are only recommended for short-term use, and physical therapy is not always effective for long-term pain relief. Many people have been turning to alternative health practices to assist with relieving chronic pain, such as herbal medicine, acupuncture, acupressure, chiropractors, and massage, but there's a lot of controversy surrounding the topics associated with alternative medicine and energy healing. Although there are people who claim these alternative health practices do indeed work, there are opposing opinions that claim energy healing practices such as Reiki are a hoax. For example, according to science-based medicine, what we actually know about Reiki is there is no evidence that this energy exists or that its movement is detrimental to health, and physical effects such as tingling must be attributed to some other phenomena. They go on to claim that Reiki is ineffective, although it may produce a placebo response, and that detoxification and boosting the immune system are bogus. How's that for contradiction? The truth is, according to physics, energy is abstract and cannot always be perceived. The law of conservation of energy states that energy can be converted in form but not created or destroyed. Einstein's famous equation, E equals mc squared, means energy is equal to mass multiplied by the speed of light, meaning all matter is energy. Not everything is as it seems, and everything is made up of energy. The particle theory states that all matter consists of many very small particles which are constantly in a state of motion. Some of these particles are so small we cannot see them unless we view them through a microscope. Just because we cannot see them does not mean they do not exist. It just means that they are not within our sensory awareness, so therefore we are not perceiving them as being present. Additionally, the author claims that Reiki is ineffective, but it may produce a placebo response. However, the definition of placebo response is a phenomenon in which the body starts to heal even if it only thinks it is receiving treatment. Shows you how powerful our thoughts are. If the ultimate goal is healing, wouldn't this mean that Reiki was indeed an effective method of stimulating a placebo response? Reiki is now being recognized throughout the scientific community as a tangible and measurable therapy which can be scientifically understood to an extent when we consider the universe from a quantum perspective. In theory, if we are putting substances in our body that may cause harmful side effects such as dizziness, nausea, vomiting, constipation, physical dependence or addiction, tolerance, and respiratory depression, we are enabling the imbalanced flow of energy in our chakras or energy centers. Now, I am not discounting the fact that there are people out there who should be prescribed these medications, especially if they are suffering from excruciating pain. I am, however, questioning why Reiki is not provided as an option for pain management initially in more cases, especially since we have an increase in opioid overdoses and deaths associated with suicide in chronic pain. So, what exactly is Reiki? Reiki is an ancient Japanese form of alternative or holistic medicine and referred to as energy healing. Reiki is primarily used for stress reduction, relaxation, and it also promotes the body's natural ability to heal itself. Reiki is commonly known as spiritually guided life force energy and is administered by a practitioner through hands-on and hands-off techniques. When a practitioner initiates hands-off Reiki, they can be administering the treatment in person by placing their hands just above the body or from a distance in an entirely different location anywhere in the world. Reiki is a simple, natural, and safe method of spiritual healing and self-improvement that anyone and everyone can use. The purpose of a Reiki treatment is to relieve pain, stress, release emotional traumas, accelerate natural healing, balance subtle bodies of energy, and induce relaxation. I can tell you that Reiki works in many different ways, but it does not work in the exact same way for everyone. Reiki goes where Reiki is needed. We are all different, and we are all made up of our own unique different sets of DNA, physically, emotionally, and spiritually. We all have been through different life experiences. Although they may be similar, they are not the exact same in many ways. We perceive differently based on our past experiences and current psychological state. We respond differently, which ultimately produces different sets of cause and effect, and we heal differently too. If you get the flu, it may only take you 3 days to feel better, whereas your family members might take closer to 5 to 7 days. It's the same concept. Our energy centers, or chakras, are the life force energy that moves inside of you. Healthy or balanced chakras spin freely in a clockwise direction. There are 7 main chakras in the body, and they are located vertically from the base of your spine to the top of your head. Each chakra is responsible for different parts and functions of your body, physically, emotionally, and spiritually. Imbalanced or blocked chakras produce emotional and physical symptoms. For example, the foundation for the root chakra is your survival, which includes your physical health, career, job, home environment, and finances. The root chakra is responsible for your bones, skeletal structure, and adrenal glands. When this chakra is imbalanced or blocked, it can produce emotional and physical symptoms such as foot, ankle, knee, and leg discomfort, lower back pain, arthritis, chronic fatigue, bone issues, kidney bladder problems, bowel disorders, fibromyalgia, depression, anxiety, confusion, and procrastination, just to name a few. More than 60 U.S. hospitals have adopted Reiki as a part of patient services, according to a UCLA study, and Reiki education is offered at 800 hospitals. Reiki is beginning to gain acceptance as a meaningful and cost-effective way to improve patient care and causes patients to heal faster with less pain. Out of 7,200 hospitals here in the United States, only 0.83% of hospitals in the U.S. offer Reiki. That's not very many. In 2008, the Center for Reiki Research conducted a randomized controlled trial for Reiki in the treatment of fibromyalgia. The purpose of their study was to determine if Reiki is as beneficial as an adjunctive treatment for fibromyalgia. Participants had 2 treatments weekly for 8 weeks. Reiki and distant Reiki were the only method of energy healing used during this controlled trial. The results of this study revealed that Reiki did not have an effect on pain or secondary outcomes. In 2019, I conducted a case study for Reiki and the treatment of fibromyalgia, and the purpose was to determine if administering Reiki treatments more frequently and combining Reiki with other energy healing treatments with coaching would be a more effective approach to treating chronic pain in fibromyalgia patients. First, I used a questionnaire form to assess past and present physical and emotional symptoms. In this case, the participant is an adult female who was diagnosed with fibromyalgia and degenerative disc disease and also has a history of long-term emotional abuse and childhood sexual abuse. She reported experiencing chronic pain, insomnia, anxiety, excessive negativity, back pain, stomach issues, irritability, and coordination problems. Next, I evaluated the health of each chakra during each Reiki treatment and documented the flow of energy. Most of her symptoms were directly associated with her initial chakra imbalances, but as I kept working with her lower chakras, the energy flow would shift in her upper chakras, revealing the remaining symptoms associated with her solar plexus, throat, and brow chakras as treatments progressed. I provided the participant with educational materials that included information on how to naturally balance her chakras at home in between her treatments, and she was required to listen to the sleep meditation every night for 30 days. She was also asked to lie down and relax during each session while listening to sound healing meditation music for 30 minutes during each of her treatments, and she reported feeling physical sensations such as tapping, warming, and pulling. Some of the reported side effects of these energy healing treatments include sudden thoughts from the past with emotional release during treatment, racing thoughts, and odd and vivid dreams. The emotional release was triggered during day 2 of treatments, which were primarily focused on her root chakra. The sudden thought from the past was simply a word that popped into her head that brought back a memory from her childhood when she was sexually abused. This triggered the emotional release, which ultimately concluded the session with a sense of relief. The odd and vivid dreams and racing thoughts only occurred during the first 2 weeks of treatments. In this case, the participants' pain levels had decreased 81.6% in 30 days, going from an average daily pain level of 6.85 to 1.28. Not only did she feel better physically, but she established new career goals and enrolled in college to pursue a higher education to eventually work in the field aligned with her life purpose, and she began incorporating more of her passions, such as art, into her schedule. She had also made some adjustments to include more nutritious food in her meal plans and has been cooking with fresh herbs more often at home. Now, this is just one person and one example, so let's take a look at another one. In 2019, I completed another case study for Reiki in the treatment of chronic pain. I used the same methods and procedures that I used for the fibromyalgia case study. The participant in this case study was an adult female who had suffered spinal injuries as a result of an accident and has a history of long-term narcissistic abuse. She reported experiencing pain in her hips, neck, mid-back, knees, and ankles with chronic fatigue, depression, anxiety, and anger. Most of these symptoms, such as the anger, anxiety, depression, chronic fatigue, knee, ankle, and hip pain, were coming directly from her blocked root chakra. The mid-back pain and anger were associated with her imbalanced solar plexus, and her neck pain with her throat chakra imbalance. Some of the physical sensations reported included a cooling sensation and lump in her throat that went away after the treatment. Side effects of these treatments were odd and vivid dreams. In this case, the participants' pain levels had decreased 61.2% in 30 days, going from an average daily pain level of 6 to 2.33. Not only did she feel better physically, but she regained her appetite and reported engaging in more physical activities. She's noticed improvements in her relationship with her daughter, has more energy, peace, and happiness in her life. These are also amazing results. Both of these case studies went through a 30-day treatment program, but is a 30-day treatment really necessary? In comparison, you can see that both participants began treatment at comparable pain levels, 6.85 and 6. The participant with fibromyalgia began treatment with the higher of the two pain levels, and once her root, sacral, and solar plexus chakras were balanced, her pain was reduced by 61.2%. The participant with a spinal injury began treatment with the lower of the two pain levels, and once her root, sacral, and solar plexus chakras were balanced, her pain was reduced by 50%. Both participants went through 7 more treatments during the last 2 weeks of the program. Participant A's pain was reduced an additional 20.4%, and participant B's was reduced an additional 11.2%, for a total pain reduction of 81.6% and 61.2%. From this comparison, we can see that most of the pain reduction occurred during the first 12 days of consecutive treatments and gradually reduced as fewer treatments were administered each week. So now the question is, would these treatments be just as effective for chronic pain if treatments were administered for a longer duration and shorter amount of time? Earlier in 2019, I completed a case study for Reiki and the treatment of chronic pain for Lyme disease. The participant in this case study was an adult male. Distance healing treatments were administered for 60 minutes each day for the first 4 consecutive days and 30 minutes each day for the remaining 6 consecutive days of this 10-day treatment program. The participant initially had 3 imbalances in his sacral, solar plexus, and throat chakras. All chakras were balanced by day 6, and average pain levels had dropped 84.2% in just 10 days. However, his pain levels drastically increased immediately after stopping these treatments. Although the medical conditions in these 3 case study examples are all different, they all have one thing in common. They all have been suffering from long-term chronic pain. In comparing these 3 case studies, we can determine that Reiki, combined with other energy healing practices, was effective in treating patients with chronic pain. Now, you could argue that there is no scientific evidence that this energy exists, or that it's nonsense, and assume the physical effects or sensations are some other sort of phenomena. You could even argue that these energy healing practices are simply just a placebo response. I could also argue that a placebo response that has proven to be over 61%, 81%, or even 84% effective in decreasing pain levels is a much healthier alternative than consuming pain medications long term. Now, I am not a doctor, and as a disclaimer, Reiki should never be used as a substitute or replacement for medical or mental health services. However, Reiki can be a highly effective method of treatment for patients with chronic pain when used in combination with other treatments, such as physical therapy, acupuncture, acupressure, and even while under the influence of prescription pain medications. Reiki is used to stimulate the body's natural ability to heal itself. Pain medications are simply a temporary solution to aid in your comfort while you are healing. Pain medications do not treat the root cause of the problem. When we don't feel well, we go to the doctor, and the doctor provides us with a diagnosis and generally prescribes recommendations and/or medications with the intentions of fixing our illness. When you ask your doctor what caused your illness, he or she may give you some common suggestions as to what may have possibly been the cause, but their focus is primarily on treating your illness or your symptoms. According to NHS UK, it is not clear why some people develop fibromyalgia, as the exact cause is unknown, but it is likely that a number of factors are involved, including possibly being triggered by a stressful event like being in an abusive relationship. Research has found that people with fibromyalgia have abnormally low levels of the hormones serotonin, noradrenaline, and dopamine in their brains, which are important for regulating things like your response to stressful situations, behavior, and mood. Disturbed sleep patterns may be a cause of fibromyalgia, and lack of sleep produces higher levels of pain. Notice I said disturbed sleep patterns may be a cause of fibromyalgia. It is possible the root cause of participant A's chronic pain and fibromyalgia were directly associated with her imbalanced root and sacral chakras as a result of long-term emotional abuse and childhood sexual abuse. The childhood sexual abuse occurred during the root and sacral chakra development phases, and emotional abuse throughout her entire life, resulting in long-term chakra imbalances all the way from the root to the crown. It is also possible the root cause of participant B's chronic pain was directly associated with her blocked root chakra and imbalanced chakras. The narcissistic abuse began during the root chakra developmental phase and continued through the heart chakra developmental phase, resulting in long-term chakra imbalances. When a person is constantly exposed to emotional abuse, they may begin experiencing symptoms of depression, anxiety, confusion, and anger. These are emotional symptoms of an imbalanced root chakra. Now, just because you might be angry one day or you might experience some anxiety before a big event, it does not mean you have an imbalanced root chakra. The imbalance starts to occur when these symptoms become routine. Long-term emotional symptoms resulting from chakra imbalances develop into physical symptoms. Using participant B as an example, the pain in her knees and ankles had disappeared after her root chakra was balanced and she was able to engage in yard work for the first time in years. Long-term physical and emotional symptoms can result in more serious problems such as chronic illness and disease such as fibromyalgia. In conclusion, the 30-day treatment programs are recommended for people who have been suffering from long-term chronic pain and/or illness and disease. The 10-day treatment programs are recommended for people who are experiencing short-term physical pain and emotional pain, such as recovering from a surgery, illness, injury, breakup, or loss of a loved one, for example. Follow-up treatment recommendations are once a month or as needed. According to David E. McManus, PhD, for patients with chronic health conditions, Reiki has been found to be more effective than placebo for reducing pain, anxiety, and depression, and for improving self-esteem and quality of life. Additionally, further research is recommended to help optimize the application of Reiki for specific health conditions and to examine the benefits arising from provision of multiple Reiki sessions over an extended period of time. According to the Center for Reiki Research's analysis, there was only one solidly negative result in a study showing no statistically significant effect on Reiki for fibromyalgia-associated pain levels. 83% of reviewers showed moderate to strong evidence in support of Reiki as a therapeutic modality in conditions relating to pain, stress, anxiety, and mood. In my own research, all participants that I have worked with personally in my own case studies have shown significant improvements in pain levels. I have not yet worked with one person that has not shown any improvements at all. I used my extensive investigative research to develop an energy healing treatment plan specifically for chronic pain patients. I have considered numerous strengths and weaknesses found in other Reiki research studies to create a more effective approach for these Reiki treatments. There is no doubt in my mind that there are people out there who have tried Reiki and have had little to no success at all. This, of course, is the worst case scenario. And if this is you, I just want to take a moment to say thank you for giving it a try. If you have participated in previous Reiki research studies for chronic pain with no success, I also would like to thank you for your participation and for your feedback. After all, every single one of those failed attempts have given us Reiki researchers the opportunity to learn, grow, and improve our practices for our communities. These 3 case studies that I shared with you today are 3 small pieces to a much larger puzzle. In consideration for past research studies, future research recommendations, and individual differences, these case studies will ultimately be compiled into a much larger sample size. If you or someone you know is interested in participating in these research studies, please visit the website at www.psycheawakening.com. Thanks for watching today. Follow me on Facebook at facebook.com/Sonoran Souls and on Twitter and Instagram at Psyche Awakening.